Okay, recording.
Hi, I'm John, and I'm here with Dr. Raichura. Dr. Raichura is a medical doctor. He's trained all over the world. And could you give us your background, your life history? Where were you born?
I was born in Africa, Dar es Salaam. Then did my matriculation there, and then went to Bombay, did my basic medical qualification. And then I went to USA, and I was there for 6 years, and trained myself as an internist, and sub-specialized in hematology.
And what year was that?
This was in 63 to 69. 1963 to 1969.
And your family in Africa was a Hindu family?
Yes, Hindu, Indian origin.
And what caste did you come from, and what origin of India, if you know that?
Indian is Gujarat, from Gujarat, and from a warrior class.
Okay. And which was your family god, or the gods that you worshipped?
Yeah, Krishna.
Uh-huh. Okay.
Hindu, Krishna.
So it was 1963 and you were in your 20s, right? Or were you older? No, you were older than that. You must have been.
I went there at the age of 31.
And were you married?
Yes, and both we and my wife and I both were doctors, and she did radiology. She's a American qualified radiologist.
Right, so you were trained medical doctors, and you trained in Boston. And,
Yes, mainly in Boston.
and you were saying that, what clinic did you train at?
Leahy Clinic, as well as at the Veterans Administration, and I was a teaching fellow at the Boston University.
Right. So you know medicine.
I hope so.
Your wife, she was also training there, and
Yeah, she was trained in radiology and qualified radiologist, American qualified.
And is she still alive?
Yes, and she's working for ashram here in Pondicherry as a radiologist.
Great. Did you have children?
Yes, one son and one daughter.
And
My son is staying in ashram, was studied here, and my daughter studied here, but she is now in California, married.
Right. So you're a doctor and a psychiatrist, right?
I'm not a psychiatrist, but I have developed special interest in psychosomatic medicine.
Right. So tell us how you work.
I don't use drugs, even though I qualified to use drugs, because I'm a qualified allopathy. I try to treat people with a completely different approach. There are levels of ability to handle higher energies to do your work. You know, like people who use, pranic healing, at the same time they do hand healing, which is done at the level of illumined mind, what Shaubindo calls illumined mind. There are levels of mind, higher mind, illumined mind, intuitive mind, overmind. Overmind is the level of Christ, or Buddha, or Krishna. So, I am doing the healing at the illumined level. And Shaubindo says that Vedas and Upanishads, Indian work which has been done at the intuitive level. Intuition means direct perception of truth. You don't use logic there. There is no synthesizing or, using the mind as an answer. So you have to go beyond the mind. So it's a direct perception of truth.
You use the word pranic and healing. And prana is best described as energy.
Yes.
Right? Describe your understanding of prana and what pranic healing means. When you look at a person's energy.
Everybody has a pranic body. There are levels of body, the physical, pranic, emotional, mental, psychic and spiritual. There are several levels of consciousness. And when you use your own prana to heal somebody else, then it is called pranic healing.
Now, what is your prana like?
Prana, the level of the prana depends upon what level of consciousness a person has reached.
Right.
If you say Christ prana is something extraordinary, same way, the intuitive level prana is is inferior, but it's much better than the mind and higher mind.
Right. And that's your gift. You've mastered
That's the area I am using.
And you've mastered that
I
area.
mastered that, and I can also initiate people into this kind of healing for those people who are ready for it.
Who are ready for it, who can receive
So I have
it.
already initiated 25-30 people.
Right. You said that you could cure arthritis, for example. How would you do that? If somebody has arthritis, and let's say they
So
have
there are
a
different
severe...
kinds of arthritis. Osteoarthritis is a mechanical problem, difficult problem. It cannot be treated with energy.
Okay.
But if you have an autoimmune disease like rheumatoid arthritis, then it can be treated with the healing of my kind. I am able to treat autoimmune diseases.
There are very few things you cannot heal that aren't of a mechanical nature, right?
Mechanical problems and organic, I would call it, are difficult to heal except through medicines like Ayurvedic, homeopathy or allopathy.
Right.
I don't use any of these.
Give us an idea of all the different things that you would like to help people with, that they're having problems getting treated medically, that you could cure them.
There are so many psychosomatic medicines, diseases like paranoia, like schizophrenia. Also other kinds of depressions like bipolar disease, reactive depression, psychic depression. There are various types of depression, past life depression. All this can be treated.
And how do you treat them? If somebody was depressed,
I first make the diagnosis. I have made a protocol for each and every therapy whereby I use that protocol to heal the patient. So reactive depressions. Chinese medicine is included in this healing work. There are 12 meridians affected in reactive depression. So I remove the blockages of 12 meridians with the healing that I am doing, and I call it delta healing. Delta healing is at the intuitive level, and the work is done in seconds. It is removed. Immediately the part which is affected because of reactive depression gets corrected immediately, and the patient feels better within a short period of time.
yeah, I've seen it work, and it's incredible. And you healed me yesterday. And what happens when? So you diagnosed me with avoidant personality.
Yes, type C personality is well known. Type C personality in allopathy.
Right.
That means you have been hurt in a relationship, and you develop feeling of sorrow and sadness, reactive depression, and you condition yourself negatively for a new relationship, and you become an avoidant personality. It's difficult for you to open up again to somebody else because your hands are burnt. This can be removed with the treatment I give.
And you removed it yesterday.
Within 5 minutes, the problem disappears.
Now, I told you that it was, or my partner Sophia would say that it's because of my mother. It's because of my mother.
You had borderline problem, and that you had it from your mother's side. It's a well-known entity in psychiatry and allopathy, borderline condition. That means you need a teddy bear-like situation. That means emotionally you are dependent on somebody and you can't leave that person. If you leave, then you have to find another one to hang on to.
Even though I've spent many years...
Once you lose your relationship with the person on whom you are dependent and hanging on emotionally, you become miserable.
So I was miserable for many years when I was living apart from anybody.
5 years. And it is difficult.
In my prior to coming to India, when I lived in California, I was 6 years as a completely single, unattached man.
This was after marriage?
No, this was, I got married very late in life. Before that...
You are talking before marriage?
Yeah, I'm talking all the way up to the age of like 42. I had long stretches...
So you never had a traumatic experience during that period with a relationship?
No, I would say I did have some traumatic... I've been engaged many times, but the engagement is broken off. But you're saying that I would go from person to person to person.
You mean as a borderline case, dependent emotionally? Mainly, one either is dependent on one of the parents who is not a borderline. That means you are dependent on your father for many years. Or you can be dependent on your brother or sister, close relation.
But I have dependency issues, is what you would say.
What borderline means?
Right.
Whatever borderline means.
What does it mean?
It means it is not psychotic, it is not neurotic, it is in between. That's why it is called borderline.
Right, okay. See, that's the old definition of borderline personality. Back in the 80s or the 70s, it was considered on the border of